Hello everyone, this is a video about biofilms. Just before jumping into the video, if you don't mind taking a quick second to please like, share, subscribe, and or post a quick comment on the video, I'd really appreciate it. So thanks in advance for taking a second to do that. And as per usual, nothing that I'm saying should be construed as medical advice. This is for informational purposes only. And if you need medical advice, please talk to your healthcare provider to get that advice. So somebody posted a question on one of my other videos saying, is a mycotoxin test the best way to find out if there is intestinal biofilms from SIBO or LIBO? If mycotoxins are high on a mycotoxin test, is this always exposure to molds and or biofilm in the sinuses? So thank you for the questions. So kind of breaking those two questions down, or answering them one at a time, I should say. So a mycotoxin test is not a test that one would use to look for intestinal biofilms from SIBO or LIBO. Mycotoxins, actually, I'm going to answer the second question first, because then it'll make the first question's answer make a lot more sense. So the second question is, if mycotoxins are high on a mycotoxin test, is this always exposure to molds and or biofilm in the sinuses? So to my understanding, if there are elevated mycotoxins in it's a urine test. Mycotoxins, for folks who don't know, are the toxins that are released by mold. And so when there's when there's mold toxins, also known as mycotoxins, in a person's urine sample, then that means that that person has been exposed to mycotoxins in some way, shape, or form, full stop. They've got into the body and that person's body has flushed them out. That's really all that it tells us. So then the question is, well, where did they come from? Is it from breathing in mycotoxins that are being released in a moldy environment that the person's spending time in? Is it mold mycotoxins that's being released by mold that lives inside of the patient's sinuses? Is it mold mycotoxins that are being released from mold that's living in the patient's lungs, which would be a very rare thing to see, but that's feasible? Or is it perhaps mold mycotoxins being released from mold that's living inside of the patient's intestinal tract, which is something that in the research literature, to my understanding, is quite a rare occurrence, but there are documented cases of that being the case of Aspergillus species mold, if memory serves. So that's really what the mycotoxin test tells us, is there are mycotoxins in a patient's body for some reason. And from there, we have to either make some assumptions that, like, oh, it's from their moldy house, or it's from past exposure, and they had, they had some sinus colonization from past exposure, or maybe intestines, or maybe lungs. So that's where, if a patient has a positive mycotoxin test, I mean, ideally what we would do is then do a nasal swab and culture to see is there evidence of mold in the sinuses, but unfortunately that type of testing is subject to false negatives. We would also ideally test the patient's home and work and any other place they're spending appreciable amounts of time to see if there's any mold there, but that would be very expensive and cumbersome. And then there is no test, to my understanding, no definitive test anyways, to determine if there's mold colonization in the intestinal tract. And then I'm really not sure how you would definitively diagnose mold in the lungs, like unless it was really bad, then you'd be able to see something they call a fungus ball on a chest x-ray or something like that, but I'm not aware of any other type of diagnostic testing, especially for, say, low-grade mold in the lungs. So that's, to be just very, very literal, that's what the mycotoxin test tells us. It doesn't tell us where those mold toxins are coming from, so we have to kind of make some assumptions. Just to clarify, because there's, kind of the theme of the question is around biofilms, it's really the biofilm itself is really just this, for all intents and purposes, inert layer of slime that's created by the mold. Other microbial species can create biofilms as well, but it's basically just this inert layer of slime that the microbe hides behind or hides within. So the biofilm itself isn't actually generating mycotoxins, but the mold that's hiding out behind the biofilms generating mycotoxins. Those mycotoxins can very easily get into the bloodstream and then go throughout the body and wreak the havoc that they can wreak in us when they are pathogenic mycotoxins. So I hope that explained, or it was a good, I hope that was a useful answer for the second question that you asked. Then the first question about, is a mycotoxin test the best way to find out if there is intestinal biofilm from SIBO or LIBO? So the answer to that is no, because the mycotoxin test is only going to tell us about mycotoxins from mold, as was just mentioned. For SIBO and LIBO, those bacteria, SIBO being small intestine bacterial overgrowth, LIBO being large intestine bacterial overgrowth, those conditions are caused by bacteria, not mold, and those bacteria don't create mycotoxins. And so again, where biofilms themselves don't release mycotoxins or any other set of kind of microbial byproducts, so to speak, then we wouldn't expect to see elevated mycotoxins as telling us about biofilms specifically. Unfortunately, to my knowledge, there's no definitive test for determining if there are biofilms in the small intestine or large intestine outside of doing biopsies of those in experimental settings. So no commercially available option for folks if they want to know about that for their own intestines. To my understanding, really the only way to, the best way to try to deduce whether there might be a biofilm component is if a patient has, SIBO, LIBO, whatever it happens to be, let's just say SIBO, or let's just say SIBO in this case. So they have SIBO, as evidenced by a lactulose breath test. They undergo treatment, they're feeling a lot better. They come off the treatment, the symptoms come back. They go on treatment, they feel better, the symptoms come back, and so on and so forth. And it just happens endlessly. And this is a relatively common pattern with SIBO, especially in folks who are primarily using antibiotic therapy to treat the SIBO. To my understanding, nothing against the antibiotic therapy for SIBO, just tends to only be for a couple of weeks at a time. And so in my opinion, I think it gives a decent amount of opportunity for the microbes to regroup. Really don't see as much relapsing in folks who are treated with herbs for longer periods of time. Again, just in my experience. So if that just keeps happening, the patient's treated, say they're treated with herbs, antibiotics, whatever, and the SIBO keeps coming back whenever treatment is stopped, that would be a possible clue that there's a biofilm component. So then you'd bring in a biofilm disruptor and then treat with that for say a couple of months, and then treat, use the antimicrobials as well, and then hopefully the SIBO goes away and just doesn't come back. And that would be clinical evidence that we were probably dealing with a biofilm in that case. There are other scenarios too where a patient might just say improve but then hit a plateau, and then despite ongoing treatment, you try all these different treatments, just can't seem to get them over that plateau. They're only say 60% improved, can't seem to get them better than that. Put them on a biofilm disruptor, and then being on the biofilm disruptor and the antimicrobials, then they improve to 100%. That would be another clinical scenario, or another scenario where it would provide a clue that there was probably a biofilm component because the biofilm disruptor was kind of the missing piece of the puzzle, so to speak. Anyways, that's another possible clinical scenario, but it's really a clinical diagnosis of biofilms, or a clinical suspicion with biofilms, and not a definitive test, unfortunately, to look for those. So it'd be really nice to have a definitive test, but I honestly don't know how they would do that unless there's some type of component of the biofilm that might just kind of get sloughed off into the stool sample, or I guess maybe into the bloodstream or something, that you'd be able to pick up to say, oh yeah, you've got elevated amount of, there's an elevated amount of biofilm protein in your stool sample. Now we're going to use that as a diagnostic test or something, but nobody's come up with that, and I don't know if there's anything that specific about biofilms where they'd be able to pick it up as a test marker. I'm sure somebody will figure it out eventually. There's lots of brilliant researchers and scientists out there, but haven't heard about any definitive tests for biofilms that's commercially available so far. So thank you for the questions. I hope this answered your questions. If you have any further clarification or need any further clarification on this, don't hesitate to post in the comment section below. If anybody has any questions or comments about this topic or anything else, just post in the comment section below, and I'll do my best to answer as soon as I can.